Hi everyone, thank you so much for joining me. My name is Hira Sabzwari and I work at the Anxiety Disorders Association of Manitoba, also known as ADAM. In today's presentation, I'm going to be discussing anxiety, as well as anxiety disorders, ways to cope with our anxiety disorder, as well as different treatment options that are remotely available at ADAM. So let's get started. So I wanted to start off by talking a little bit about ADAM and helping you to become familiar with us. So ADAM has actually been around for 33 years. It was formed by people who have anxiety to help others who are currently struggling with anxiety. We provide services, support, and education throughout Manitoba from a variety of outreach locations, and our main office is located in Winnipeg, found at number 4 Fort Street. The really amazing thing about ADAM is that we're a peer-led organization. So what does that mean? Basically, all of our staff and all of our volunteers have lived experience with the debilitating effects of anxiety. We truly understand how difficult anxiety can make life. We understand how much it can impact our day-to-day functioning. We also understand the courage that it takes to seek help. So when you come to find support at ADAM, you can be confident in knowing that the person you reach out to has lived experience, and we empathize and we understand. ADAM is also self-help focused. So what does that mean? For folks that have an anxiety disorder, it can oftentimes feel like you are powerless, or you feel helpless, or you feel like your life is kind of out of control. And with a self-help focus, what we hope to do is empower people to learn the skills and different coping strategies to be able to moderate their anxiety symptoms. So in that, we really want to empower people and give them a sense of control back over their anxiety. So what is anxiety and is it normal? So this is a question that I quite often get asked, especially from people who have an anxiety disorder. And I know for myself, when I learned about anxiety, I was very surprised when I first found out that anxiety is indeed normal. At healthy levels, it's a normal bodily response that helps us to respond to threats, to stressors, and to changes in our environment. I know I don't really have to describe it. I think most people have had the feeling of anxiety and can recognize the sense of worry, apprehension, uneasiness that anxiety brings. It's quite often related to something that is coming up in the future that we're uncertain about, or it can be related to something from our past. So it can oftentimes be triggered if we have a painful memory. So I wanted to give examples of each of these. So for painful memory, it can be something related to a trauma that we experienced. And when it comes to a future event bringing on anxiety, an example would be if you have a presentation that's coming up next week for work, and you have a heightened feeling of apprehension, nervousness, stress, you might be a little bit afraid. That feeling is anxiety. So anxiety is something that really helps us to respond to situations in our life. It can energize us. It can help us to remain aware, to motivate ourselves, to help us keep safe. In the right amounts, it works for us and it really benefits us. So an example of this would be, consider the presentation we were talking about that's coming up next week. Now, you're feeling uneasiness, you're feeling fear, you're feeling really stressed out, and you feel motivated to prepare, to kind of, feel a little bit more in control, to feel like the presentation is going to go better, to be a little bit better prepared. So that motivation to do that is actually your anxiety that's helping you. Anxiety is usually based in the feeling of a loss of control, choice, and time. So when we are able to respond to it with a healthy level of anxiety, we're often able to feel a little bit better about our situation. And so that's a healthy level. So when do we know our anxiety has kind of gotten to a place where it's unhealthy? So when anxiety isn't helping us, when it's no longer working for us, when it's no longer adaptive, it's a problem. When it's working against us, it's a problem. So how do we know when anxiety has become a problem? So usually this is related to having too much anxiety. When does that happen? So I have a few examples here on screen for you that I'm going to go through. So if you experience a heightened level of anxiety, so a fight, flight, freeze response, without there really being a threat or a stressor or change present, that's problematic. If you are having a heightened level of anxiety and it doesn't match, say, the stressor or the change or even the threat in your life, that's problematic. So an example of this would be if you have an exam coming up, certainly some anxiety in response would be healthy. It would be normal, and it would help you to even study or respond to the exam coming up. But if it's making you feel like your life is in a threatening situation, that is problematic, because now you're going to have an excess level of anxiety, and that type of reaction is not going to be adaptive in response to having to study for an exam or having to write an exam. Next is if anxiety doesn't diminish. So certain situations in our life will definitely bring on anxiety, and it's very healthy and normal to have anxiety in these situations. But once that event has passed and the anxiety hasn't diminished and it continues to be at a heightened level, that is no longer working for us, and instead it is working against us. And then finally, the way that I oftentimes like to summarize is that anxiety has become a problem when it has started living our lives for us. When anxiety starts influencing your choices, your decisions, and starts to limit you, anxiety has become a problem. So, who does anxiety impact? So, an anxiety disorder can happen to anyone. 1 out of 4 people will experience it in their lifetime. Anxiety does not discriminate. Anyone can get an anxiety disorder. So, regardless of your gender, regardless of your sexual orientation, your ethnicity, um, your education level, the career that you have, anyone can have an anxiety disorder. And I want to focus a little bit here on the statistic. 1 out of 4 people, so 25% of people in their lifetime, will experience an anxiety disorder. What I want everyone to know is that this statistic is specifically based on people who have been diagnosed with an anxiety disorder. There are a number of reasons why some people may not have a diagnosis. And they might still have an anxiety disorder, but they simply might not have a diagnosis. So in thinking of this, some people don't have a family doctor, so they might not get a diagnosis. Other people might feel uncomfortable talking to a family doctor or a therapist about their mental health, so they won't get diagnosed. And there's a number of other reasons why a person might not receive a diagnosis. It could be shame about sharing how a person is feeling. It could be fear of stigma, internalized stigma. It could be for social reasons or family reasons. A lot of times people might be brought up in a family where you don't talk about mental health or talk about emotional well-being, and that person might be less likely to come forward and talk to somebody, including professionals, about experiencing struggles with their mental health. So it's important to note that this statistic here is limited to the people who have been diagnosed, but there are certainly many reasons for people not receiving a diagnosis, which means there are many people who likely have an anxiety disorder who simply just are not included in this statistic. So when it comes to mental health and anxiety disorders specifically, we have to recognize that there are a number of negative experiences that people face, and these can certainly affect the overall sense of well-being that a person has. It can leave people feeling marginalized, hopeless, a heightened sense of despair, isolation, loneliness, heightened stress. So, and a lot of these come from enduring discrimination, prejudice, trauma, systemic barriers, abuses, and oppressions. These can have a correlation with experiencing a mental illness, including anxiety disorder. So I have several of these listed here for you that kind of discuss the different ways in which people can kind of face different types of struggles. And quite often it's based on things that people can't really change or control in their life. And that can be very difficult. And it can really, cause a lot of harm mentally and emotionally. So it's important to be aware that these things can definitely increase the likelihood of developing an anxiety disorder. So types of anxiety. So there's a number of different types of anxiety disorders, and they are listed on your screen. At Adam, we help with generalized anxiety disorder, panic disorder, health anxiety, as well as social anxiety disorder. And there are certainly other types of anxiety disorders. So if you do need support for those, you can give us a call and we will help you get connected to a resource that might be more helpful and more specialized in other areas of anxiety disorders. So in speaking about anxiety disorders, there's many different types and there's lots of overlap. It's not cut and dry. And it's not simple. A person can have more than one type of anxiety disorder. For example, you might have a primary anxiety disorder, and then you might also experience symptoms of a secondary anxiety disorder. So I myself have social anxiety disorder. And for me, I've also experienced symptoms of generalized anxiety disorder as well as panic disorder. So as I said, it's not cut and dry. There's lots of overlap. And a person can experience different types of anxiety disorders or aspects of different types of anxiety disorders at the same time. And then the other thing to consider is that anxiety can often also go hand in hand with other types of mental illness as well. Many people might experience anxiety as well as depression or anxiety and addiction. So anxiety is something that can come up in a variety of different health-based scenarios. And it's important to note that anxiety can be evoked by environmental stimuli. So when we consider, for example, the current environment with the pandemic going on and with the different social issues that are coming to light, certainly this can bring on a heightened sense of stress, apprehension, uneasiness, fear, feeling threatened, feeling helpless and hopeless. And that can certainly evoke an anxiety disorder to come on. So there are 3 characteristics that anxiety disorders have in common, and these are bodily sensations, cognitive distortions, as well as coping mechanisms or our behavioral responses. So I wanted to talk about each of them just a little bit. So when we talk about bodily sensations, we're talking about some of those pretty familiar physical or physiological reactions that most of us have experienced when we've had heightened level of anxiety. Feeling your heart racing, having a hard time breathing, muscle tension, dizziness, shaking and crying, feeling on edge. I know some additional ones are your hands might get really cold. You might feel adrenaline rushing through your body. And there's also depersonalization. So this one is basically a feeling of disconnection that can oftentimes occur for people when they're having an anxiety reaction. You kind of feel disconnected and almost like you're watching your life from a distance. And that can be very difficult and scary for some people when they experience. All right, next I wanted to talk about the cognitive distortions. So what I think. So for many folks that have an anxiety disorder, they will experience different types of cognitive distortions. You can have several types at once. You can have some that are more prevalent than others. The cognitive distortions are basically, we sometimes look at situations from a lens that might not necessarily be neutral or realistic or even positive or calming. Sometimes we might see things from a perspective that is a little bit more negative, a little bit more black and white, or more highly analyzed or overthinking a situation. So some examples are feeling excessively judged. So I know for me with social anxiety disorder, this is something that I used to really struggle with when my symptoms were quite bad. Whenever I used to walk into a room, I used to feel like everyone was watching me, judging me, evaluating me, and that was extremely difficult. Quite often, I used to overanalyze situations and overthink situations. Even different events where that wasn't really required, and also all or nothing thinking. So I remember, when I was younger, for me, this used to come out quite a bit when it came to school and writing exams or handing in assignments. Everything had to be perfect. And if it wasn't perfect, I felt like I had failed. So again, these are cognitive distortions, and they can really impact a person's way in which they view themselves and view their own capacity and intelligence, and also the world, of course, around them. Next is behavioral, or how a person copes. So there's a few different types of coping mechanisms that I have listed here. And what I want to say is that in terms of the coping mechanism, this is in response to the uncomfortable feeling that a person gets from the physical and cognitive characteristics of anxiety. So a person is trying to lessen that discomfort. They're trying to cope with the physical and cognitive. And sometimes they really just want relief because it can feel so terrible. So with coping mechanisms, sometimes a person with anxiety will turn to unhealthy mechanisms. So avoidance, social withdrawal, escape, anger, irritation, safety behaviors, and the use of alcohol and drugs to feel relief from the physical and cognitive characteristics of anxiety can happen for people. And I want you to know that quite often when a person with anxiety chooses avoidance or say escape or anger, it's not necessarily because we want to choose it. Sometimes we feel like there's no other way out. There's no other way to feel relief. And it can happen quite quickly in terms of the cycle between physical, cognitive, and behavioral. And the more that we turn to a certain coping strategy, the more likely we are to use it in our future experiences of an anxiety-provoking situation. So this response is strengthened over time. For me, I used to use quite a bit of avoidance and escape behaviors. I know anytime my anxiety was heightened, I used to feel so incredibly uncomfortable that the only thing I thought I could do was run, was escape, was leave. And that's what I did. And even though that oftentimes impacted my life in very negative ways, in the moment, I did not think of that. All I wanted was instantaneous relief. I was not thinking about what the consequence would be from that. It's just, I wanted relief. So please be mindful of that. I wanted to talk a little bit about the different anxiety disorders that we help with at Adam. And so we're going to get started with generalized anxiety disorder. So for generalized anxiety disorder, it's essentially described as a person's thoughts kind of get out of hand. They become exaggerated, uncontrollable. There's excessive worries. And I kind of sometimes use the term like it's like a train of thoughts that can't seem to stop. So it's ongoing thoughts, and it's very difficult to control. And it isn't usually related to like a big event that's coming up. It's everyday problems. So for example, the anxiety that a person feels prior to, say, writing exams or prior to giving a presentation, or during the holidays, that anxiety will usually pass for people once that event has passed. So that's not generalized anxiety disorder. Generalized anxiety disorder is ongoing, and it's not specifically related to some type of big event or specific event. It's everyday problems. So you might find a person is thinking about, their career, if they make it in life or if they don't. What if their boss doesn't like them? What if their colleague doesn't like them? What if they never get a promotion? Or what if, so there's a lot of what ifs that seem to come up. And there's always this expectation of something bad is going to happen. There's like an impending sense of doom, almost like something just doesn't feel right. People with generalized anxiety will oftentimes ask others in their presence for reassurance and for approval. There is a tendency towards perfectionism. And the perfectionism comes up because it's a way in which a person with generalized anxiety can feel a greater sense of control and hopefully prevent anything bad from happening. Uncertainty is very difficult for people to deal with when it comes to generalized anxiety. I know for me, this was one of the secondary symptoms of generalized anxiety disorder that I experienced in addition to my social anxiety. And for me, uncertainty used to bring on a heightened sense of just helplessness. And I remember I would freeze when I had to make decisions. I would feel incredibly overwhelmed, and I would just not be able to deal with uncertainty. And it felt completely impossible to me to be able to make a choice, to be able to make any type of decision when there was a lot of uncertainty involved. And there's also a heightened level of restlessness, and almost like a person is constantly on the go. They're constantly doing something. Very go, 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 I should say. So that comes up quite a bit for people with generalized anxiety disorder. Next, we have social anxiety disorder. So social anxiety disorder is one of the, I guess, the anxiety disorders that I'm very, very, very familiar with. And I certainly have experience. When I look at this slide, many of these are things that I experienced, that I have personal lived experience with. And I will give a few personal examples. I know for me, this was a problem that really, although I had it, or some aspects of it when I was a child, it really didn't impact my life until I got to university. And it was at that point that it really started impacting my life in a negative way. I remember feeling very isolated and alone, and oftentimes I didn't understand what was happening or why I felt so extremely self-conscious or so afraid of confrontation or criticism. What I remember is anytime I would receive um, any kind of negative feedback or even positive types of criticism where, you know, it was to help me to grow, you know, with my classes from like a professor or from, you know, someone who's trying to help me, it used to make me feel incredibly self-conscious and almost humiliated. And it was very difficult to kind of manage. I was very concerned about what others thought of me. And in different situations, I oftentimes felt like my performance was being judged. And I'm not talking about situations that would oftentimes come with being evaluated or judged. I'm talking about something as simple as ordering coffee. So I remember when my anxiety was really bad, when I would be in the lineup at a coffee shop, the entire time I would be practicing my order in my mind, and I would want this really fancy drink. And then as soon as I would get to the front of the line, my fear and my anxiety on being judged would build up to the extent that I would just order black coffee. And I have to say, I'm a fan of black coffee now, but back then I really wanted something really delicious and ridiculously fancy looking. So I was just so afraid of being judged and of ordering something in a way that wasn't correct, that I wouldn't be able to proceed with what I wanted. So the reason why I brought up that example is that it's not always in the big situations where social anxiety can come up for people. I know some people who have a lot of social anxiety if they have to return an item in a store, or if they have to raise their hand and ask a question in front of people. Some people have it when they're eating out in public. It could be a variety of situations, and it's not constant. So every type of social situation might not bring it up for a person. It can be very specific for each person. So for example, I might have a very easy time being around my friends where I can be more boisterous, where I can be loud, where I can be extroverted. And I might not feel social anxiety, but in other situations, like in the past when I would order coffee, or if I had to ask a question in front of a classroom, those situations would leave me feeling completely frozen, and I couldn't be loud or boisterous or comfortable. Instead, I would freeze. Um, Other aspects of social anxiety are that it can come with negative impacts before and after the social event. So for me, I remember prior to social events, like having to go to an important class or an important lecture, or going to write my exam, I would feel so much heightened anxiety that I remember I would be shaking, my eyes would be tearing up, I would feel nauseated, dizzy, my head would be spinning, and that was even before I got to the actual social situation. And then if I was able to get to the class or the exam or whatever it was, I remember afterwards when I would be coming home, I would feel almost like I had run a marathon. I would feel absolutely exhausted and drained. And I know for me, it would be almost like I didn't want to talk to anyone or have a social experience for several days after. It was that exhausting. And finally, I'd like to add that social anxiety is not the same as shyness. I think sometimes this comes up, but what I want people to remember is that with shyness, it might be sometimes uncomfortable in certain situations, but a person is still able to respond or react to their environment. With social anxiety disorder, a person completely freezes and they're unable to respond and react. And even if that is to the detriment of the person, even if there are negative consequences, in certain situations, a person just freezes and they cannot proceed with whatever it is that they would proceed with at a normal and healthy level of anxiety. Next is panic disorder. So panic disorder is something that is very sudden. It comes on out of the blue. It's very random, and it's very difficult to identify sort of the cause of it or the root of why it happened, or what caused it in the first place, I should say. It's very physical. So on the left side of your screen, you'll see a number of different symptoms that are listed. So there's, of course, the trouble of breathing, tightness of chest, a racing heart. There's numbness and tingling, choking sensation, lightheadedness. A person can oftentimes feel like they are losing control, or like they're having a heart attack or an asthma attack. It can be a very, very scary experience. And as I mentioned, the first time a person experiences a panic attack, it can be very troubling because it's something that they may have never ever experienced before. And it's very scary. Many people actually end up going to the doctor or to the ER because it really does feel like they might be having a heart attack. So the interesting thing is that panic attacks are actually very common, and everyone experiences panic attacks. To be diagnosed with a panic disorder, a person has to have more than 2 panic attacks within a given period of time. And then after that, there needs to be at least 1 month of time where a person is actively changing their behavior, changing their routine, changing their just different aspects of their life in order to prevent another panic attack from happening. So what does that mean? So the best way to describe it is that if a person was to have a panic attack, for example, at a grocery store, they might feel that perhaps it was the grocery store that brought on that panic attack, and they may no longer go to grocery store. Next, they have another panic attack, say at the library. This person might then start avoiding libraries. And so again, now you're avoiding a grocery store, you're avoiding a library. Little by little, people will start eliminating different things from their life, and their world will essentially get smaller and smaller, simply because they're trying to root out whatever it is that is causing the panic attacks. And quite often, this can actually lead to agoraphobia occurring, where a person has a very hard time leaving their home because they have an extreme amount of fear of having a panic attack out in public, somewhere where they might not be able to get help, or somewhere where they might not be able to escape or get away from whatever setting they're in. So that can be a very extreme response to, I guess, panic disorder, agoraphobia. So what is panic disorder? What is happening during panic disorder or panic attacks? So a good way to describe it is almost like it's a fight, flight, freeze response that's occurring, but there isn't any type of threat that is present. So it's almost like a car alarm that's very sensitive that starts going off without there being anyone around. I think we've all even walked by certain cars where the car alarm starts going off, and we've merely walked by. We haven't even touched the car. We're several feet away from the car, but the alarm is going off. So quite often, it's a good way to describe it, I guess, is our body is sounding an alarm without there being a threat that's present. And then there's health anxiety. So with the current pandemic, these last few months, and I'm recording this in June, but these last few months have been really difficult on people. And They've come with a lot of uncertainty, a lot of constant changes, having to adapt to different situations. Different people have experienced different types of stresses and losses, whether it's loss of employment, the inability to leave one's home, having a greater level of responsibility. So, for example, some people are now working from home while they're also homeschooling their children. So this entire experience has really brought on a lot of change in what we were doing in our day-to-day maybe 6 months ago. And in addition to that, there's been a lot of fear and uncertainty related to COVID-19. And having an excessive amount of worry and fear and anxiety is a natural response to something as scary and uncertain and as extreme as what we're dealing with right now. And sometimes this anxiety can come out as health anxiety. So what is health anxiety? So health anxiety is a type of anxiety where we develop an excessive and an uncontrollable level of fear based on either ourselves becoming ill or a loved one becoming ill. And this fear consumes us, and it's maybe something that we think about all the time. Health anxiety can come on even if there is no previous history with an anxiety disorder. It results in people being very preoccupied and very tuned in to any type of bodily sensation or any kind of change in their bodily sensations. So if they perceive, say, like that their temperature has gone up a little bit, they worry. It's like a huge red flag for them, and it starts sounding an alarm. It increases anxiety excessively. People will regularly check for changes, and any kind of change that does occur that they perceive, they will oftentimes assume the worst, and they'll consider it to be evidence of having developed an illness. People with health anxiety oftentimes become very, very consumed by news and information related to illnesses, as well as to different treatment options. And the interesting thing is, I want to make sure that I provide a differentiation here. Certainly, there are people who will read information and they will follow the news, and this will actually reduce their level of anxiety. So if you're following, if you're checking the news once a day, or if you're looking at statistics, or if you're curious and want to learn facts and you're, just reading based on that and it reduces your anxiety, you feel fine. That's not the same as health anxiety. When a person has health anxiety, they will constantly check for new news stories, new information. They'll want to read as much information as they can. But this excessive need for information and consumption of information will not actually reduce their anxiety or their worry. So that's one of the differences, I guess you could say, in terms of maybe like a healthy level of looking for information versus a level that's a little bit more unhealthy. So a person with health anxiety will oftentimes feel a loss of control, uncertainty, and helplessness. They'll feel a lot of hopelessness in response to the situation that they're in. And it will be very overwhelming, and they might feel very panicky. A person may alter their behaviors and start avoiding activities because of their excessive level of fear. And you might find people are going above and beyond in terms of recommendations for reducing the potential of contamination. So they'll go above and beyond even what might be recommended by a healthcare professional. There might be excessive cleaning, excessive decontamination, excessive use of cleaning products or washing your hands, or just constantly being afraid that you might get sick. And you'll also see that a person that's having health anxiety, the quality of life and quality of their relationships will really start to be impacted negatively, and their day-to-day functioning and the roles that they have in their life. So examples are the role of being a parent, the role of being an employee, a colleague, or um, a supervisor or a student, any of those roles, the effectiveness with which they are able to enact those roles and take on the responsibilities of those roles will also be impacted negatively. So why does anxiety happen to some people at unhealthy levels? Or why do people develop anxiety disorder? So there isn't a clear-cut reason that every single person who's experienced anxiety disorder, why they would have experienced it. There's actually there's a lot of overlap in terms of the contributing factors, and it can be different for different people. And the other thing is that these contributing factors merely act to increase the likelihood of potentially developing an anxiety disorder. They don't necessarily cause an anxiety disorder. It's just increasing of a likelihood versus actually, a cause. So it's important to remember that. So I have some of those different factors that are listed here for you, and I'm going to go through them. There's genetic predisposition. Anxiety disorders have been found to run in families. There's twin adoption studies that have shown that people, even if they've been raised in different environments, genetically they're the same, and they've had a greater likelihood of developing anxiety disorder, even if they've been far apart and in different environments. So there has been some evidence of that genetic predisposition. There's also temperament. So when we refer to temperament, we're referring to a very foundational or very basic or essential type of trait that a person has. So for example, a person who's extroverted versus introverted. People that are introverted, there's a little bit more of a likelihood of developing social anxiety disorder versus those who are extroverted. There's also learned behavior. So this is one that oftentimes we don't think about as being a contributing factor for increasing the likelihood of an anxiety disorder, but it's certainly a very important factor. So when we are younger, we're oftentimes looking to our caregivers or other adults within our presence that we trust, that we respect, and we're looking to them to learn how to react to different situations. So kids will oftentimes, watch their parents or they'll watch their caregivers in different situations to see how to react. I know I can give an example, which is kind of interesting, and I think some of us may have seen this happening. I know one of the times that I saw this kind of in action was a close friend of mine. She has a daughter, and her daughter was playing, and she kind of tripped and fell. The first thing she did was look to her mom and dad, and she wanted to see how they reacted. And she was ready to kind of cry, but when she looked to them, they reassured her and they encouraged her to kind of keep playing and that she was okay. So she actually went about and played. I've also seen similar reactions where a parent has maybe rushed to a child, rightfully so in some cases, but in some cases maybe the parent has been extremely anxious, and the child might react in a more extreme way. So that's kind of a childhood example, but when we think about it from adulthood, I guess what we can say is if we watched our parent reacting to a situation, a stressful situation in a certain way, we might start modeling that behavior in our own life as we get older, as we're adults. So for example, if you remember your parent getting up in the middle of the night, checking the stove 3 times, 4 times, 5 times, you might find yourself having similar behaviors where you are constantly checking something, or where you worry when you leave the house if you lock the door, if you turn the stove off, if you turn the lights off. So it could be different things like that. There's also negative childhood experiences. These can be long-term negative experiences, so long-term neglect or abuse. It can also be something which is a single experience that a person has, so something traumatic. And there can be also stress. So all of us are familiar with what negative stress looks like. I think many of us have been experiencing quite a bit of negative stress recently with the pandemic going on. But there's also positive stress, and positive stress can also bring on enough of a heightened level of stress or apprehension or worry sometimes, where it can increase the likelihood of developing or having the onset of an anxiety disorder. So what do I mean by this? So I think some examples that I can give that many people might be able to relate to are if you think back to getting a new job or getting into a program at school or being able to retire, having a baby, moving to a new house. All of these experiences are really positive and good for a lot of people. At least that's what many people might, perceive them to be. And even if you perceive these different scenarios to be positive, they still come with a lot of stress. If you think back to a time when you got a new job, you might remember the first few weeks as being quite stressful, to adjust, to adapt, to learn quickly, and to try and do your best. Moving is another one. It's awesome to move to a new house or a new apartment, but the moving itself can be something that's very stressful. It comes with a lot of different factors that are stressful. So it's important to keep in mind that these are some contributing factors, and they can impact the likelihood of developing or having the onset of an anxiety disorder come up for people. These can impact people at varying levels, and it's not a cause, it's just an increased likelihood. So quite often we are very concerned about what exactly is the reason that we have anxiety. What are those causative factors, or what exactly has contributed to developing anxiety? But what I want to say is also very, very important to also learn different ways in which to cope with our anxiety disorders and manage those symptoms that can sometimes be incredibly problematic. So it's important to do that. And we oftentimes try to highlight that in addition to the learning of what it is that has caused the anxiety. We also want to know how to cope. So what are some things you can do to cope? So you start off by learning about anxiety disorders as well as treatment options. I feel like it's very important to get informed. Quite often, it can actually help lessen the anxiety we might feel about our own anxiety disorder. Learning more sometimes can be helpful for some people. And learning more can kind of give back a sense of control as well. So I've listed some different sources for information that are really great sources. I wanted to talk a little bit about family doctor. If you have a family doctor, it can be really important and critical to work with them to manage an anxiety disorder. And I say this because it's quite often a doctor will also check to make sure there isn't any other type of underlying illness or any type of disorder or deficiency that is manifesting as anxiety symptoms. So you want to have a doctor helping you along your journey because it can really help to provide greater information and to eliminate any other potential causes. So this is really important, and I oftentimes highlight this for people. There's also EAP, which is Employment Assistance Programs. These are related to work benefit programs, and it's definitely something to check into. Many of these programs offer mental health related benefits and are confidential, and certainly an excellent resource. Psychologists or therapists, counselors, social workers. There's a variety of different types of mental health professionals that can also be incredibly helpful in learning more about anxiety disorders, treatment options, and in getting treatment as well. And then there's internet sources that are reliable. So when I'm talking about these, I am referring to sources that have evidence that can be backed up by research and are supported by, you know, experts and studies. So Adam, CMHA, Anxiety Canada, all of us post different types of information on our sites that are supported by evidence and by research and studies. It's not necessarily a good thing to refer only to Dr. Google or WebMD. You want to get reliable and good information. Next is CBT, or cognitive behavior therapy. This is another great way to cope. Cognitive behavior therapy essentially helps us to slow down that cycle of anxiety that comes up. So earlier when we were discussing the characteristics, we talked about the physical, so the bodily sensations, the cognitive, so some of those cognitive distortions, like the all or nothing thinking or feeling excessively judged, and then the behavioral. So the different behaviors that people turn to in order to cope with the cognitive and physical discomfort. So avoidance, social withdrawal, safety behaviors. So CBT effectively helps us to recognize our automatic negative thought patterns. It helps us to slow things down enough that it kind of catches us before those thoughts spiral. And we're able to slow things down enough that we're able to catch those thoughts, and we're able to start challenging them with something more realistic and calming. So for me, I remember when I was starting to practice some of the principles of CBT in my own life and challenging my social anxiety, I remember in situations where I would have usually tried to avoid or escape, I tried really hard to remain in those situations and to talk myself through those situations with realistic and calming thoughts. I remember responding to some of those negative thoughts. So if my negative thought was everyone here is judging me, my realistic response would be like, well, not really. Everyone's kind of looking at their own phone and everyone looks pretty busy with their own lives. And calming thoughts were something along the lines of, I know this is stressful. I recognize that, but it'll be okay. I've gotten through this before. I can get through this again. And I can breathe through this. And just reminding myself that I'm okay and that I'm capable of managing and getting through that situation. Next is facing fears gradually. So this isn't about jumping into the deep end. We really want people to gradually build up to facing their fears little by little. So for example, for me, when I had social anxiety, I had a very difficult time leaving my house. There were years that I really did not leave my house. And to start gradually facing my fears, I actually started with just opening up the door and standing behind the screen door and looking outside. The next week, I went and I grabbed the mail. The week after that, I went on a walk in my, around my house, outside, just along the street outside my house. And then after that, it was building up to being able to say hi to people who were passing me by on the street. So gradually building up and facing bigger and bigger fears is basically another aspect of CBT. And then of course it helps us to accept that life is unpredictable. And sometimes there's things that come up and we might not expect them, but that is okay. And we'll be able to get through those things and we'll be able to manage and cope. There's also mindfulness. So when I spoke about anxiety earlier, I talked about how it can oftentimes be related to something we're uncertain about in the future, or it can come up related to something from our past. So with mindfulness, it helps to bring us back to the present, and that's really important. There's a few different techniques listed for you, including relaxed breathing and meditation. And then there's self-care for balance. So it's really important to take care of ourselves holistically. Anxiety affects us holistically, so we should take care of ourselves holistically. A lot of the different things listed here are the same types of things that your doctor might ask you to do, like eating well, getting enough exercise, getting consistent levels of sleep, human connection, journaling, gratitude, and making time for fun. I know for me, journaling was a really great one. It really helped me and it really benefited me. Initially, I was not a believer in journaling. I did not understand the reason for having a lot of negative thoughts in my mind and then also having those same thoughts in paper format. But I very quickly realized that for me, journaling really helped to slow things down and help me to get my thoughts out of my mind. And it was easier to look back and really assess my thoughts at a later time because I had them on paper. There's also medications. So there is no shame with medication. And this is something where you would want to consult with your doctor. If you choose to go ahead with medication, there's a few different types of options. Again, you would consult with your doctor. Some of the more commonly used ones are antidepressants as well as anti-anxiety medications. And of course, with medication, it takes patience, time, and consistency to really get, a medication result that you're looking for. So again, just there's no shame, consult with your doctor, be patient, be consistent, and also be kind and compassionate to yourself. Coping with health anxiety. So we talked a little bit about health anxiety and how it can oftentimes consume people. And it can be very troubling and difficult and can affect a person's quality of life, their relationships, their effectiveness with roles, as well as different responsibilities and day-to-day functions that a person would usually have. So with health anxiety, there's a number of different things that you can do to cope. You can focus on the things that you can control in your life. You can limit the time that you spend consuming information about the virus. And I should add that you can also limit your sources of information. So using reliable sources. There's also relaxation and mindfulness, focusing on resilience. And if you find that you need additional support, being open to getting that additional support is another really great way to cope with health anxiety. So at Adam, we have a number of services that we are currently offering that are remotely offered. So they practice and support social distancing, and they're all available to you. So I have them listed here and I will quickly go through them. We have our anxiety support line with the phone number listed, 204-925-0040. If you find that you need some additional support in relation to anxiety that you're having during this time, definitely give us a call and we will get back to you within 24 hours. There's also our anxiety and worry support program that's currently being offered. The phone number is 204-925-0606. So this is a really wonderful program that's being offered. It's 6 weeks of cognitive behavioral programming. It's provided free of charge, and you work closely with a trained peer support worker. And this program is awesome in the sense that it actually provides people with the opportunity to connect with somebody on a weekly basis. The peer support worker will help provide answers to different questions you might have. They might help by providing individualized peer support to you. The program can be offered via phone, email, or a different online platform. And essentially, you work through this program and you're supported through it with the peer support worker. There's also a support group for anxiety. You would call 204-925-0600 for more information. And then there's public information sessions. So again, you would call 204-925-0600. And this is actually a public information session that you're reviewing right now. And we offer them to just about anyone. And we can certainly modify them to make them a little bit more orientated towards the audience. So if it's parents who want to learn about anxiety that their children are experiencing, or if it's teachers, or if it's different not-for-profit organizations, we're certainly available and very happy to provide a public information session. So definitely give us a call. Again, 204-925-0600. And I would like to add that our services are for individuals who are 18 years and older, and our services are not counseling. Registration is also required. So whatever you choose in terms of a treatment option or a strategy to moderate and cope with your anxiety symptoms, whatever it is that you choose, whether it's services that are provided by Adam or different services, or choosing a more medical route or anything. What I want to add here is that I hope that you will be kind and patient with yourself. I hope that you will show yourself compassion during this time. Oftentimes when we are younger and all throughout our lives, we are often taught to be kind, patient, and compassionate towards others, but we're not always taught to do the same for ourselves. So it's really important that we show ourselves the same level of kindness and compassion and just positivity. Also, when it comes to treatments, be consistent. Results will take time. You might try CBT-based programming and you might go to a single session, or perhaps you'll do a mindfulness session once or twice, and you might not necessarily feel a huge difference immediately. And I think sometimes we want to feel that instantaneous relief and experience a huge change in our anxiety level, but that doesn't happen right away, and it's unrealistic to think that way. Results take time. I like to describe it similar to working out. So day one, when you go to the gym, at least my personal experience of working out on day one, I usually feel exhausted, I feel sore, and sometimes I feel like I have no clue what I'm doing. But honestly, day 30, day 60, day 90, I feel stronger as the days go by. I start feeling more confident and more capable. And I feel better. And that's the same thing when it comes to mental health. When you're working on your mental health and your wellness, it will take time, but the results will show if you're consistent, and the results will get stronger and stronger over time. So definitely, please do consistently practice whatever it is that you decide to turn to for treatment, and know that in time there will be results, and you will feel more confident, capable, and just in general better able to cope with your anxiety symptoms. So I have our main line listed here for you. If you have any additional questions, comments, or concerns, please give us a call at 204-925-0600. You can also head over to our website at adam.mb.ca, and also look for us on social media. We have a Facebook as well as an Instagram account, so please give us an ad. And I just want to say thank you very much for joining me with this presentation. I know that these recent few months have been incredibly stressful and anxiety provoking for a lot of people. And I just want everyone to know to hang in there, that we're going to get through this, and tough days are going to happen, and that's okay, and that we can get through this. And I wish you, and I wish you wellness as well as health and safety during this time. Thank you again for tuning in, and definitely connect with us if you think that we can provide support for you. Thank you so much.